Thank you all. So it's my pleasure to reciprocate and have an opportunity to introduce Bethany Kwan, who is an implementation researcher, one of the 3 stars who are about to speak to you. And in addition to what you can read in the bio, I'll just point out another key contribution where she and I first got to know one another, and that is her role in designing and conducting the initial years of the Colorado Pragmatic Research and Health Conference Series, which has a very rich website with lots of good material from multiple years of conferences. So those of you who are interested in the Précis wheel concepts and pragmatic research, that is the go-to place for you. I know Bethany will talk about a slightly different set of issues today, but she wears a number of hats and has a lot to offer. So, Bethany.
Great. Thank you. So today I'm going to talk to you about the overarching framework for this conference series that Dr. Legrone has asked us to consider. And so one of my areas of work is in what we call designing for dissemination and sustainability. There's a ton of jargon in that, and I hope to break it down for you as well. So I'm at the University of Colorado, where I direct our Dissemination Implementation Research Core, or our Clinical and Translational Science Award that's the CTS. No conflicts of interest, unfortunately, as people say. Okay. So the field of dissemination implementation science is predicated on the idea that to enhance impact of the products of our research on health and health equity, that our innovations must be broadly adopted and sustained in real world settings. We've heard a lot about that over the last day or so. And a lot of this reference to this idea that it takes 17 years to put 15, 20, sometimes 50% of evidence into practice, like different numbers there. And of course, that's a very old statistic. And not really a statistic so much as an estimate. I'm hoping that since DNI came into existence over the last 20 years, that we've improved that a little bit. But we know that there are several barriers to dissemination and sustainability that limit the impact of our innovations on health and health equity. And when we boil it down, it's this idea that there's a poor fit. What do we mean by fit? We can talk about that between our innovations and the intended context for use. There's evidence this works, but not here. We also know that the research paradigms that we've used to develop and test our programs, our innovations, doesn't always provide the type of evidence we need in order to actually implement and sustain those innovations. And so Dr. Mitman just discussed pragmatic trials, pragmatic research. It's still very rigorous. Pragmatic does not mean loose. It doesn't mean lack of rigor. It means that we're testing our innovations in the context in which they would be used. Finally, another barrier is that the cultures and systems that we have that incentivize our work as scientists tend to focus on things that do not necessarily prepare our evidence for use. And that is, we are incentivized to write papers, get them published, and presented at conferences. But we know that those are not necessarily the best ways to have people actually learn about and take up and use our innovations. So what do we do about that? Designing for dissemination and sustainability introduces principles and methods for addressing those barriers, for enhancing the fit between our health innovation, our program, our policy, our practice, in the context in which it's intended to be adopted and used. And early and active dissemination and sustainability planning. Dissemination and sustainability planning is not something you do in the last 3 months of your R01. You need to think about that while you're writing the proposal. We also reference some definitions. So designing for dissemination means the process of ensuring that the products of research are developed to match the contextual characteristics of the target audience and setting for use. in early planning and design processes to increase the likelihood of sustainment of an evidence-based program or practice after initial implementation. And so we published a review in the annual review of public health a couple of years ago now, synthesizing a lot of the evidence on how this has been done. So this emphasis on process, this is an ongoing process. These are methods. The principles of designing for dissemination and sustainability boil down to beginning with the end in mind, ensuring innovation context fit, and planning for active dissemination and sustainment. What do we mean by beginning with the end in mind? I'm going to tell you a little story. Bear with me. So in Greek mythology, Prometheus was a Titan god of forethought, the creator of human civilization, known for intellectual and craftsman pursuits. Known to have molded humans from water and clay, Prometheus provided humans with the practical tools and knowledge they would need to not only survive, but to grow and improve over time, including fire, science, and the arts, way beyond curing cancer. And so Prometheus championed the cause of humans against the gods to his great peril. You might be aware of his story, his end story. His cunning and forethought, his ability to outwit the gods is lauded. In contrast with the foolishness and lack of foresight of his brother, Epimetheus, which means afterthought. Prometheus, I like to think of as the origin story of beginning with the end in mind. So in recent years, we've increasingly come to recognize that our traditional approach to health research is more Epimethean in nature. We design and test our interventions, our programs, our service delivery models using tightly controlled scientific methods to establish efficacy and grow our knowledge, just like Prometheus. We publish our efficacy trials in academic journals, and then sometimes we move towards dissemination beyond academic audiences, and perhaps we evaluate population health impact and advocate for policy changes that enable sustainability. I actually saw you all do a lot of that already around all of these guidelines. That's fantastic. Dissemination, impact, and sustainability are typically afterthoughts or even someone else's job. I'm here to tell you, it is our job. It is our job that active dissemination and sustainability is within the scope of work of researchers and our partners. There's no getting out of it now. So that is, in adopting what we call a D4DS perspective, scientists should start by considering who will ultimately benefit from uptake and use of our research products, who may not, and if the expected benefits are likely to be equitable. Consider who will need to change practice or policy, who will need to invest resources, who will need to develop new skills or apply skills in new ways. And so in thinking about your intended audience and level of impact, I've heard this question a lot over the last days. Who needs to be in the room? Who needs to be at the table? So think about the adopters. Who's actually going to use and apply that evidence? The influencers, those who make the decisions about what's important, about how resources are going to be applied, about what you're going to learn about in school. And then everyone always loves this, the potential saboteurs. Who might stand in the way? Who might not want change because of perverse incentives, because it's hard to change, or because they have some competing alternative that they think you should do instead? You need to know who they are and what they care about. Might also bring in this social ecological model perspective. So I really like to think about all these different perspectives here. The individual, whether you're talking about a patient, a community member, provider, what individual needs to change? What are the interpersonal factors at play? What is the community in which they live and work and play? What are the organizations in which we work, and that where a lot of those influencers and potential saboteurs might exist? And then finally, the policy or the enabling environment. Who ultimately is making decisions at the system or cultural level about how we provide care and to whom we provide care and when. So I've talked a lot about kind of these broad principles around our health innovations, or what it is that we're designing for dissemination and sustainability. So what do I actually mean by the products of our research? Often we have this negative reaction in research to the word products because it feels like you're talking about a commercial product. That's not what I mean, although we can certainly commercialize some of what we do. So when I talk about products of research, I mean our evidence, our programs, our treatments, our interventions, our services, perhaps technology or infrastructure, our dissemination and implementation strategies. Dr. Mittman talked about the importance of implementation strategies, our education, our facilitation support, our technical assistance, our clinical decision support tools. These are all what we mean by implementation strategies. Policy and guidelines, probably the principal product that you all are here to think about, and then our methods. A second D4DS principle, ensuring innovation context fit, refers to when the products of research are developed in ways that match the needs, resources, workflows, and contextual characteristics of the target audience and setting. And it means in ensuring research products fit the context of intended use, both at the outset and over time. Your work is never done in this regard. Job security. So we often in dissemination implementation research, we love our frameworks. I haven't heard a lot about DNI frameworks over the last couple of days. It's probably our greatest jargon, but also our greatest strength in DNI is we have these wonderful frameworks like you see here. This is the Practical Robust Implementation and Sustainability Model, or PRISM, and it outlines all of the various contextual characteristics or contextual factors that you need to consider in designing your products and designing your dissemination, implementation, and sustainability strategies. There are many. There's a whole website, dissemination-implementation.org. It's a wonderful catalog of them. It can be very overwhelming, but there are some that tend to rise to the occasion very often, including PRISM and REAIM. There are several others. You might be familiar with the Consolidated Framework for Implementation Researchers. So really, when I talk about this idea of fit, we're talking about whether your intervention characteristics and your internal and external context align with each other. A third principle concerns the importance of planning for active dissemination, and we contrast this with passive diffusion, such as publishing manuscripts in journals and hoping they reach our intended audience eventually. This is a purposeful process of identifying your intended audiences and packaging and distributing your messages and materials to those audiences in ways that will support uptake of evidence. Active dissemination beyond standard publications and presentations, especially to non-academic audiences, is often a lower priority for scientists. But what I've been glad to hear over the last couple of days is that there are actually people that is their job, that they can take up and advance that work. So partnering with them throughout the process is important. So how do you apply these three rather broad principles in research? So following this literature review that we published in ARPH in 2022, we developed a novel process framework that integrates other existing frameworks to guide researchers and partners through these D4DS strategies at every stage of research, from early conceptualization to design to dissemination to impact. So Fit to Context is a 4-phase process framework. It considers design of a research product and dissemination and sustainability plans from the perspective of ensuring fit to context, so that underlying concept. Our products being designed are culturally appropriate and feasible for use in resource-limited settings, align with strengths and assets of that context, and improve outcomes that matter. So here is the framework. I'll walk you through it a little bit. So in the conceptualization phase, we determine first the need and demand for a solution to a health problem. We think of this as the pull. Anyone here familiar with the concept of push-pull capacity? So it's commonly used in smoking cessation. And the idea here is that we're often the push. We're trying to get people to change behavior, follow our guidelines, but there's also needs to be a pull. There needs to be some sort of need and demand for change from those who you're expecting to make that change. They need to want it. You can lead a horse to water, so to speak. You can't, our providers drink your guidelines. And it also draws upon an evidence base of effective strategies for addressing the health problem. And so to effectively disseminate the evidence in response to demand, our D4DS approach then considers our design phase. That is, what is the research product to be disseminated? How will it be packaged and delivered? And how would it be sustained and paid for and supported? What's the workforce in real world settings? So the design phase involves an active process of developing a research product and planning for dissemination, scale up and sustainment, as well as evaluating and iteratively improving these design phase outcomes relevant to ensuring context. And then finally, our research product design and resulting dissemination plan is followed by active dissemination, that is making use of systems and infrastructure, that is the capacity to take up and use your product packaged to broadly reach your intended audience, that is our push. And then finally, the impact phase considers our research product adoption, sustainment, and ultimate impact on health and health equity at the population level. I was listening yesterday for, well, what are the data sources you can use to assess that broad population impact? I heard data from the CDC. I heard data from the DoD can be available to evaluate on a large scale whether your innovations are being taken up and used, and are they reflected in policy. So let's see, in my last 2 minutes, I want to tell you a little bit more about how you actually go about doing this. What does design look like? I could spend probably several hours talking you through all of these different methods that you could use for your design processes. What are the methods, the frameworks, the approaches that you can use to co-design your product and prepare your dissemination and sustainability plans? Really, principally, it is participatory co-design and community partner engagement are foundational. And that's really what you're doing here over these couple of days of beginning that co-design process. I mentioned the importance of applying our D&I theories and frameworks. Marketing and business approaches are certainly critical, especially for sustainability planning. Methods for context and situation analysis. To understand fit, you need to understand the context. So systematic, qualitative, and quantitative methods for assessing context. Systems engineering and complexity science approaches are critical, especially when you have very complex multi-component interventions and very large complex systems where you really do need to engage those influencers and potential saboteurs. And then communication and the arts. Who doesn't love something beautiful and well explained? So partnering with experts in strategic communication, science communication, graphic designers to make your products beautiful so that people actually have a pleasant experience when engaging with them is important. So who do we engage? I really like the 7 Ps framework for engagement and the 7 different categories. They all start with Ps, our patients and the public, providers, policymakers, purchasers, those making purchasing decisions, payers, those who actually pay for healthcare and health services may not be the same as your purchasers. Your product makers have often thinking about technology, but not exclusively. And then principal investigators, it just starts with a P, you mean the research enterprise. So how do we actually go about engaging our communities, engaging our partners? I'll just briefly show you, we developed our Engagement Navigator web tool. It's available for free online at dicemethods.org. And it includes both an education hub and an interactive selection tool for identifying 30 different methods for engaging community members in the process of research. There's a lovely video of me, please don't watch it. The Education Hub includes many definitions, principles, and an overview of how to navigate the website. And then in the interactive selection tool, which we developed using user-centered design, it's a very meta process, Our users first identify the purpose of their engagement, what they're trying to accomplish, as well as logistical factors like budget, time, and expertise. And so you use this slider tool to, after you've selected your purpose to indicate what level. All right, there you go. And so you've selected your purpose, you indicate your budget, your time per interaction, the number of interactions, who is it that you're trying to engage, and it adjusts the color and size of these different methods. And then you can click on them and they give you brief definitions, and then they take you to a whole strategy fact sheet that walks you through a how-to for each different method that you might use. And then finally, we have a brand new D4DS planner tool, which was developed in partnership with Washington University in St. Louis, led by Dr. Mara Pepper, as well as colleagues at Northwestern and the University of Colorado. And it guides research teams. You can collaborate, you can save your project and share with other people through the conceptualization and design phases of the fit to context framework. And here's just a couple screenshots. So each of these different circles, sorry, this feels like it's very loud, each one of them has an interactive section where you can provide information and create an action plan for your D4DS activities. So if you're curious about how to assess context, there's this lovely page with lots of resources on context assessment. That's it. Thank you. Yes.
How do you find the balance between, getting broad implementation of guidelines versus maybe less than perfect local? And so you can get local buy-in. I'm not sure if you manage that.
So how do you balance local implementation with
Less than perfect local implementation. So
less than perfect?
So
Yes.
they implement it, but they make some changes, so they'll accept it. So it's maybe not the exact guideline you want to implement it, but if you want widespread implementation, they're going to have to make local changes. Maybe it makes the
Absolutely.
product less perfect.
So I mentioned how much we love our frameworks. There is a great framework called FRAME, the framework for adaptations and modifications. I forget what it stands for. And there's a version for our products as well as our implementation strategies called FRAME IS. And so that's a great tool that helps you systematically think through and identify, describe, and report the adaptations that are made with local implementation. It was about who made the adaptation, what the adaptation was it to the content, was it to the delivery, was it to the context? And so, I think this was mentioned earlier, there's a lot to learn from those local implementation and the adaptations that were made, because we can start to identify some of those adaptations that actually make something fit better. In CFR, in the CFR model, there's this idea of peripheral aspects of implementation, where you can make a lot of changes without necessarily changing the core function of how your intervention or how your program or guideline actually works. So there's a science to that, and we can report on those in the literature and certainly encourage you to do that.
Thank you so much.